Hey there. So, you're a new parent, and your number one job is keeping your baby safe, right? Of course it is. But then, life happens. You get sick, or you have a condition that needs treatment, and suddenly you have to take medication while you're breastfeeding. It can feel like you're walking through a minefield. So today, we're going to cut right through all that confusion and give you the clear, straightforward info you need.
This is the big question, isn't it? It's on the mind of so many new moms, and getting a straight answer is just, well, essential. The good news is that a lot of medications are totally fine, but others require some serious caution. So we're going to break it all down, and we'll start with the ones you really need to pay the most attention to.
Okay, so think of this first list as the big flashing red light zone. These are the medications that are generally a no-go during breastfeeding because the risk they could pose to your baby is just too significant.
Now, when you look at this, you can see how specific these warnings are. We're talking about things like chemotherapy agents, methotrexate, for example, which could potentially weaken a baby's developing immune system. And then you've got something like lithium. A baby's brand new kidneys just can't clear it out of their system very well, so it can build up to toxic levels. It's serious stuff.
I really want to pause on this for a second because it's so important to understand. Some of these drugs carry a risk of something called bone marrow suppression. Now, what does that mean? In simple terms, it means the drug could stop the body from making new blood cells, the very cells needed to carry oxygen and fight off infections. This just shows you the serious stakes we're dealing with in this high-risk category.
So, as we continue down the list, the reasons for caution are crystal clear. Radioactive substances, the kind used in certain medical scans, can actually expose the infant to radiation through your milk. Illicit drugs? That's an absolute no-go for obvious reasons. And that antibiotic, chloramphenicol, that's the one we just talked about, the one linked to that critical risk of bone marrow suppression. These are definitely not drugs to be casual about.
Okay, let's shift gears a bit and move to our next category. These drugs aren't necessarily forbidden, but they 100% require a serious talk with your doctor. This is that gray area where you and your healthcare provider have to carefully weigh the risks versus the benefits for your specific situation. Here, you'll probably see some more familiar names. High doses of aspirin, for instance, can pose a bleeding risk for a baby. Some anti-seizure meds, like phenobarbital, can build up in an infant's tiny system and just make them incredibly sleepy. And if you're on high-dose steroids for a long time, it can even affect a baby's growth.
Now let's talk about another huge concern that goes beyond the direct effects on the baby, and that is your milk supply. I mean, for anyone who's committed to breastfeeding, the thought that a medication could accidentally dry you up, that's a really big deal. It's a great reminder that the risks aren't just about what passes into the milk.
And this list really drives that point home. Certain birth control pills, especially those with high estrogen, are well known for reducing milk supply. Same goes for something called ergot derivatives, which are sometimes used for migraines. Then you have drugs like statins. And what's tricky here is that the data is still pretty limited. So because we don't know for sure, caution is absolutely the best approach.
All right, so we've talked about some heavy-duty prescription meds, but what about the stuff you can just grab yourself at the pharmacy, for a cold or allergies? It's so easy to think that over-the-counter drugs are totally harmless, but when you're breastfeeding, even those everyday remedies need a second look.
Are you noticing a theme here? Sedation. Decongestants with pseudoephedrine can not only tank your milk supply, but might also make your baby irritable. Older antihistamines in large doses, some cough syrups with codeine, and of course excessive alcohol, they can all make an infant dangerously drowsy, and a sleepy baby might not feed well, which can impact their development. The bottom line is simple. Over-the-counter does not mean risk-free.
Okay, I know, we've gone through a lot of cautions and warnings. It might feel a little overwhelming, but it doesn't have to be. Let's totally pivot now from the problems to the solutions. Here is a clear, actionable checklist to help you make the absolute safest choices for you and your baby.
This is your game plan. First, and this one is completely non-negotiable, always talk to your doctor or a specialist. Second, if a medication is truly necessary, your new mantra is the lowest effective dose for the shortest possible time. Third, here's a smart little strategy. Try to time your dose right after a feeding to minimize how much is in your milk for the next one. And finally, remember, you are the world's leading expert on your baby. Trust your gut and watch them closely for any changes at all. And this is a really critical point we need to highlight. If your baby was born prematurely, or if they have any other health issues, their little bodies are even less equipped to process medication. So the need for extreme caution and expert medical advice in these situations is just that much higher.
Look, if you take away only one single thing from our chat today, please let it be this. This information is your guide. It's here to help you ask the right questions. It is not, and never can be, a substitute for professional medical advice from a specialist who actually knows you, your health history, and your baby's unique needs.
So, as we wrap up, I'm just going to leave you with this question to think about. At the end of the day, being informed is being empowered, and knowing what to ask your doctor, well, that's the first and most important step you can take to protect your child while still taking care of yourself. Stay safe out there and stay informed.